is Danka, and I'm here with
Stephanie
and
Roberta
and Abigail. Okay, so today we are going to educate nurses on how to access the thyroid gland and also identify the signs and symptoms of hypothyroidism.
To access the thyroid gland, I'm going to do that with my colleague Stephanie, and Miss Abigail will be our patient for the demonstration. And to access the thyroid gland, it's important that we know the landmark, and the landmark is the thyroid cartilage. That is what we have to know. And to locate the thyroid cartilage, Miss Stephanie, please can you locate the sternal notch and move your fingers to the up, feeling the ribs. And once we get to the thyroid cartilage, you inspect to see whether the skin is even and no rashes, no lesion. So once we get that, it's important to also know that the thyroid gland is not visible. But for us to get it, we have to palpate it bilaterally on both sides. And to palpate it, I'll ask Miss Abigail to turn her neck to the right side for us to check the thyroid gland on the left. So Miss Stephanie, as she has turned her neck to the right side, you use your fingers on your right side to displace the thyroid gland to feel it on the left side. Do you feel it? So on this note, we ask Miss Abigail whether she has any pain or tenderness.
No.
Okay. And to do so for the left side, we ask her to do so for the right side, we ask her to turn her neck to the left side. Can you do that for us? Okay. And Miss Stephanie, please displace the thyroid gland, and do you feel it on the right side?
No.
Okay. So once she palpates, she also have to take note to feel whether there's any nodules or masses. And Miss Stephanie, did you feel any mass or nodule?
No.
Okay. So in case there is a mass or an enlargement, we have to auscultate it with the stethoscope to hear any blood sounds. So for that is the assessment of the thyroid gland. Oh, and also one thing to note, we have to note for the movement of the thyroid gland. So ideally we have to give Miss Abigail a cup of water to drink, but we don't have water now, so we'll ask her to raise her neck and look on the ceiling and swallow her saliva for us to see the movement. Okay, so as she swallows her saliva, we can see the movement of the thyroid gland going up and down. So on that note, we say Miss Abigail's thyroid gland is symmetrical and is midline, and no abnormality was detected. So thank you, Miss Abigail, for being our patient for the demonstration. Then our focus is going to be on the hypothyroidism. So what is hypothyroidism? Hypothyroidism is low production of thyroid hormone. And the thyroid hormone, one thing we have to know is that it has its roles and functions. And some of its roles is to help in metabolism. And some, it also helps in the regulation of our body temperature, digestion. And it also helps in how food digests fast in the body. And when the thyroid hormone is produced less, it put those functions less. And when it becomes less, we have some signs and symptoms that the person experiencing it will show. But first, we have to know what causes hypothyroidism. And the causes we have here, one is not enough in iodine. A person taking a diet which is less in iodine is prone to have hypothyroidism. Another one is anti-thyroid medication. Someone taking anti-thyroid thyroid medication can have a toxicity which will cause low production of the thyroid hormone. An example of some of the anti-thyroid medication is the proteazoles agent, which is also causes the low production of the thyroid hormone. The next is the autoimmune disease. Some autoimmune disease like lupus, Hashimoto disease can attack the thyroid gland, which will cause it to produce less hormone. And another cause is thyroid surgery. In a person who has gone through thyroidectomy, removal of the thyroid gland, can also experience the hypothyroidism. The next is pituitary disorder. Any pituitary disorder can also affect the thyroid gland, which can produce less. So for somebody to have hypothyroidism, how can we know as nurses when a person presents to us, how can we know that this person is experiencing hypothyroidism, and to know that we have some signs and symptoms to identify that? And one is fatigue. A person who is going through hypothyroidism will feel tired easily. They cannot tolerate activities for a long period of time, because remember I said one of the functions of the thyroid hormone is metabolism. And another is enlarged thyroid hormone. When the thyroid gland is producing less and the body system is trying to correct that disorder, as a result of that disorder, it can cause enlargement of the thyroid hormone. The thyroid gland and when on the assessment, if you're doing the assessment, you can see that there is a misalignment when you view the neck of the patient when the person sits down. And I mentioned earlier, if you see such an enlargement on the neck, then you as a nurse, you have to auscultate for any bruit sounds. And the next signs and symptoms is constipation. Because of the hypothyroidism, everything is less. It will affect metabolism. The digestion of food will be slow. So such patients will experience constipation. Another is cold intolerance. Because their metabolism is low, they are not able to generate much heat, so they feel cold easily. Another one is bradycardia. They experience low heart rate as a result of hypothyroidism. Another symptom is memory loss. They lose memory easily, and also they can experience depression. So these are most of the general signs and symptoms that patients go through who have hypothyroidism. So on that note, if anybody have any question, feel free to ask, and if you have any contribution to is, you are mostly welcome. So on that note, I will say thank you for your attention and for your cooperation.